Hi, my name is Melissa Dobbins. I'm a registered dietitian and a certified diabetes educator. I'm also a spokesperson for the American Dietetic Association. I'm preparing for a TV segment tomorrow, so I thought I'd give you a sneak peek. I'm talking about nutrition and diabetes during pregnancy. Now, obviously, nutrition during pregnancy is very important, but it's even more important if you have diabetes during pregnancy. And with the rising rates of diabetes and recent changes in the diagnostic criteria for gestational diabetes, we could be seeing up to 23 to 28% of all pregnancies affected by diabetes. Now, the best thing you can do to provide good nutrition for your baby is to meet with a registered dietitian and sit down and work together to create an individualized meal plan specifically for you. Now, if you have diabetes during pregnancy, whether it's gestational diabetes or pre-existing diabetes, those high blood sugars, if they're uncontrolled during pregnancy, can pose serious risks to you and your unborn baby. These risks are completely reduced and controlled through diet and, for some people, medication. So I've got 4 tips for pregnant women, and especially pregnant women who have diabetes. The first tip is that eating for 2 does not necessarily mean, it actually doesn't mean at all, eating twice as much food. It actually means eating about 300 extra calories a day. So I've got 3 snack ideas here that are nutrient rich and provide about 300 calories. This is 2 slices of whole grain bread and 1½ tablespoons of peanut butter. This is 6 ounces of yogurt and 1/2 cup of granola. And this is 1 ounce of almonds, which is about 24 almonds, and 1/3 cup of raisins. So each one of those snacks is about 300 calories and very nutrient rich. Snacking is very important during pregnancy, so keep those snacks in mind. The second tip I have for you is to build a better breakfast. Ironically, the traditional breakfast that we would have, which is cereal, milk, and fruit, is probably one of the worst breakfasts you can have if you have diabetes during pregnancy. Just 1 cup of cereal, 1 cup of milk, and 1/2 a banana is already 60 grams of carbohydrate, which is way too much during pregnancy with diabetes. The hormones during pregnancy cause the blood sugars to be very difficult to control in the mornings, and this really overloads the blood sugars. A better choice would be 2 eggs and an English muffin, perhaps even a breakfast sandwich that has ham and cheese. You're only getting 15 to 30 grams of carbohydrate with that, but you're still getting a lot of good nutrition and something very satisfying that's going to hold you over till snack or lunch. The third tip I have for you is foods or beverages that you really should just steer clear of altogether. Fruit juice, even if it's 100% fruit juice. Regular soda, any concentrated sweets or sugary foods. Even white rice can be problematic. If you're having rice, you really want to limit to about 1 cup serving, but it's much better to have brown rice than white rice. We really see a difference in the blood sugars. Also, food safety is very important. Pregnant women are much more susceptible to foodborne illness than non-pregnant women, and listeriosis, actually 1/3 of the cases are in pregnant women. So lunch meats and soft cheeses can be a problem. You want to avoid any lunch meat unless you heat it till it's steaming hot. Soft cheeses are okay as long as they're made with pasteurized milk. So brie, feta, goat cheese, such as those, you want to make sure the label says made with pasteurized milk. You want to avoid any raw milk cheeses or any raw milk for that matter, all pasteurized milk products. And the 4th and final tip is go ahead and treat yourself. It's actually a wonderful bedtime snack to have 2/3 cup of regular ice cream at bedtime. It's the perfect combination of carbohydrates, protein, and fat that helps stabilize the blood sugars overnight into the morning. When those pregnancy hormones make the blood sugars hard to control in the morning, we see much better fasting morning blood sugars when the woman with diabetes during pregnancy has 2/3 a cup of ice cream at bedtime. So these are just 4 simple tips for you, but I really encourage you to sit down with a registered dietitian if you're pregnant, and especially if you have diabetes during pregnancy, to create a meal plan specifically for you. Invest in your baby's health and give your baby the gift of good nutrition. This is Melissa Dobbins, and I'll see you next time.